Welcome to the Cataraqui Woods Dental Implant Institute, a nonprofit organization dedicated to furthering both education and research in the field of oral implantology. My name is Dr. Waji Khan. Today's presentation is brought to you by the Top Gun Dental Implant Study Club. I run this study club. To learn more about it, please go to www.topgundisc.com. Become the best of the best through education, training, and mentorship. And the best part, it's free. So today we have a product review of the Implant Direct Legacy Implant System. We're going to be focusing on the Legacy 1 implant. So the agenda or the outline for today is going to be a number of things. Number one, we're going to give you a brief product introduction. Number two, specifications for the product in terms of packaging and reported features. Features in terms of what's new and what's missing with this implant system. Number four, a review of the surgical and prosthetic tools and a comment on the ergonomics of these. Number five, we're going to talk about performance in terms of both price and quality. Number six, we're going to discuss some comparables for this implant system. Number seven, we're going to give you some case examples of the use of this implant system in a real live patient. And finally, summary and conclusions. So product introduction. So Implant Direct implants were the brainchild of a gentleman by the name of Dr. Gerald Nisnik in 2004. Prior to this, he had founded the Corvent and the Paragon implant systems, which were sold back in the 1980s to Zimmer, which basically became the foundation for what they call the Zimmer tapered screw vent implant. So Dr. Nisnik started Implant Direct in 2004 and basically launched it in 2006. And in 2010, the company was purchased by Cybron, who also, I believe, owns Nobel Biocare now. The Legacy 1 implant, which is the implant which we're going to discuss in this presentation or in this product review, is based upon the tapered screw vent implant by Zimmer. So in terms of product background here, this is a catalog. You can see that there are a number of types of Legacy implant. There's a Legacy 1, which is very much like the tapered screw vent implant. Legacy 2 implant, which has a more aggressive thread pitch. The Legacy 3 implant, which comes with a abutment that you can use and some different types of pitch to the actual implant itself, but not as aggressive as the Legacy 2. And then finally, the Legacy 4, which comes with some detachable components and stuff. In terms of specifications for this implant, in terms of product and packaging, the implant itself comes, the Legacy 1 that is, it comes in basically four different platforms. There's a 3.7, a 4.2, a 4.7, and a 5.7 millimeter implant. If you were to purchase the Legacy 2, 3, or 4, they do come in a 3 millimeter. I believe they throw in also a 7 millimeter implant with those types. You can check those out on your own. And we'll also talk about some of the reported features for this implant. So this picture here basically outlines the difference between the Zimmer tapered screw vent implant and the Legacy 3 implant, which Implant Direct claims is to be a more advanced version of the tapered screw vent implant. You'll notice that the implant on the right, the tapered screw vent, has a vent, and the vent is now gone. The purpose of that vent used to be to collect all the little bone shards and stuff when you were sort of self-tapping the implant in, which they don't really do anymore. They more or less allow it to tamp out against the lateral walls to condense the bone a little bit more. Nonetheless, it's a great implant. It's one of my favorite implants, the tapered screw vent that is. The Legacy 1 is based off it, and that's why I do use it a fair bit in my practice. This picture here basically depicts, once again, the different product line for Implant Direct implants and the various things that sort of come along with it. And you do get a lot. The implants that have the white coating is something which they called HA versus SBM. So SBM stands for sandblasted and HA stands for hydroxyapatite. So there's really not a lot of clinical evidence to suggest that the hydroxyapatite implants are any much better than the SBM ones. Some people, they drink the Kool-Aid and they believe what they want to believe. So if you like the hydroxyapatite coating, you can pay the extra. I believe it's $25 US in order to get it. If you don't, then just go with the standard SBM covering. So going to the packaging is quite unique in the sense that it comes in these little vials that picture on the left, and inside the vial, depending on whether you get the Legacy 1, 2, or 3 implant or 4 implant, the Legacy 1, which we'll focus on here, basically comes with the implant, which is connected by, in this picture here, it's a plastic insertion tool. It now comes with a metal insertion tool, which works really well. And on the bottom of the vial is basically a cover screw with what they call an extender, which you can also convert that cover screw into a 2 millimeter healing abutment. So you get a fair amount of of things with this. You're not having to buy the healing abutment, assuming that it's a superficial, or there's not a lot of soft tissue on top of the site that you're placing the implant, and you're also getting the cover screw as well. And then basically the pictures on the right sort of depict the different sizes, that being 3.7, 4.7, and the 5.7 millimeter implant. In terms of packaging, here's basically a photograph of one of the Legacy 1 implants with that metal insertion tool. And you basically take your 2.5 millimeter hex driver that comes in the Implant Direct surgery kit, and these are very easy to place in. The other nice thing about these little metal insertion tools is that you can sort of use these once the implants have been placed as paralleling tools, or basically tools to see which relative height implants are being placed at if you're placing a bunch of them, for example, for a denture in the mandible. So in terms of reported feature, what's new and what's missing? Basically, it's not really a lot of stuff that's new with this implant. It's basically the Zimmer tapered screw vent implant. I'm sure Implant Direct doesn't want me to say that for legal reasons, but I'm not representing the company in any way, shape, or form. Basically, it has the internal hex design, the 45-degree internal hex with the micro threads in the coronal portion, with a fairly conservative thread pitch pattern, and the sandblasted surface for the titanium, along with a domed apex, so that you don't basically go beyond where you cut. In terms of what's missing with this implant, the Legacy 1, that is, if you take a look at the whole product line, you have the options of different pitches with the actual implants and how aggressive they are in terms of getting stability in different types of bony cases. There's not really a hell of a lot that's missing with this. Other than basically giving you a free coffee and a bowl of ice cream, you get a fair amount with these actual implants. And in terms of the packaging coming in the vials, it makes them very easy to transport if it's the case that you're having to transport a number of implants from operatory to operatory. So in terms of the surgical and prosthetic tools, here's a photograph of the surgical tray and the surgical drills. They've done a great job in terms of color coding this whole system and making it flow fairly nicely. And not necessarily this is applicable to the dentist, but many times it applies to your assistants or people who are going to be involved in the CSE, the combined sterilization room, or so I guess I call it CSE, sorry, it's a CSR, but it's a combined sterilization room, in terms of making sure that they put all the components back. There's good laser etching of the actual burrs in terms of being able to depict the heights or the length that you've been drilling for when you're doing your osteotomies and stuff. And lastly, there's numbers on both the shaft and on the actual drill itself in terms of in order to depict which actual burr it is. There's not really a lot of room for spare in this kit here. You'll notice that there's the direction indicators on the right. There's the extra components for the interactive. There used to be spare components or spare room on here if you wanted to put, say, like a Lindemann burr or some other special type of burr that you like to use for your particular implant system. Nonetheless, when you do open up the case, there are room or components underneath to store your handpiece and different wrenches and stuff like that. Going to the next slide, Implant Direct does not have a W&H or the Implant Med motor unit. They have this Nuvog unit that you can use. I haven't really used this one in practice before. I use the Implant Med unit, which is pretty much standard for across most implant companies. Nonetheless, this motor, I read the reviews on it. It's fairly decent. It's not bad. It's been around for a long time. It's fairly affordable, and there's a lot of different things you can sort of add on to it. You can use it as a surgical motor as well for taking out wisdom teeth if you do a lot of dental-alveolar surgery. In terms of torque wrenches and stuff, I really like this multi-torque setting wrench which Implant Direct provides for you. It's actually not made by them, it's just sold by them with their lettering, but it's probably one of the most affordable ones that you can get. I believe it's around $399 US, and you can also get various tips for this. If it's the case that you are using a different type of implant system and you want to use this wrench, you can get different tips from a company I called either Salvin in the United States or the Surgical Room in Canada. My friend Dan Sampson, he runs that company. Very nice guy as well. Going to the next slide here, basically you can see there's a whole variety of abutments and stuff that you can get for this implant system. Anything from a lab abutment to a snap-on to some sort of like UCLA gold plastic abutment to a locator abutment to multi-unit and angled abutments. And these are available for pretty much any of the platforms that you can see on the right, that being the 3, the 3.5, the 4.5, or the 5.7 millimeter platform. In terms of ergonomics, well, it's a standard Nuvog MD11 at 30 unit with a handpiece. I mean, you're not limited to using this system, and I'm sure your Implant Direct rep will not, hold you in contempt if you were to use a different surgical system. This is just the one that they sell on their website. The kit, as I mentioned, flows fairly nicely and logically, though there could be some room for adding some spare components to it. There's lots of small parts. This is sort of like my comment about everything. You need to basically be wary of the fact that these small parts can get lost, and when you rely upon your staff, so your dental assistants and your other surgical staff, to take these small parts and go through the CSR and stuff, it can become a bit challenging. In my own practice, we've ended up losing lots of small parts over the years, and the cost does add up. The one nice thing about Implant Direct is that the cost of a lot of their components is a lot less than, or not even a lot less, it's significantly less than what you say pay for like a torque wrench or an impression coping or something like that from, say, Nobel Biocare or Straumann. The color flow system also works very well, and I wrote down here, there's some room to add your favorites if you have the old surgical kit, but the newer surgical kit unfortunately does not have that capacity, as they've had to add components for the interactive system. So in terms of performance, in terms of price, it's a no-frills price, but it comes with a lot. The components and abutments are also fairly low priced. In terms of quality, I would say this is a high quality product with great packaging, excellent service. And the other thing I really like about this company is that they have amazing online ordering. So once again, if you're missing something or you need to order something really quickly, you don't have to sit there and call your rep. As much as we like to be social in practice and stuff, just log in, order what you need, press click. It saves all your information, and next day, after you pay $25 for US for overnight ordering, and boom, there you go. Bob's your uncle. You got everything in your office the next day. In terms of comparables, there are many, right? So basically, the legacy one is a more affordable and compatible version of the Zimmer tapered screw vent implant. The manufacturer has implants that basically rival most of the top implant producers in the world. So there's implants that are basically similar to the Straumann system. There's implants that are similar to the Nobel Biocare system. There's implants that are similar to basically you name the system, and they kind of have something that can kind of work for you. What's kind of funny though is that they don't have any implants that are compatible with the AstraTech, or I believe it's Dentsply implants now, the AstraTech implant system. I always found that a bit weird, but anyway, moving on to the next topic here. Case example. So we have a 49-year-old healthy male who presents with a missing upper right central incisor, and he'd like an implant solution, and he wants ideal aesthetics. So as you can see in this photograph here, you see a gentleman who has a very low smile line. He also is missing a front right central incisor. You'll notice that the space, you don't have to be a genius to figure out that the space between the central incisor and the adjacent central incisor is going to be a space difference unless we address this from a cosmetic perspective. So we presented a number of options to this patient, including orthodontic work to try to space things out more appropriately. And from his perspective, basically, he just wanted something that was going to be conservative. So you see this photograph here where the patient is retracted. We take a radiograph, you can see there is a bit of a vertical bony deficiency. So we're going to have to graft this to a certain extent. You'll also notice from a width perspective that the one tooth is 8.8 millimeters, and there's about 7.1 millimeters of space. So basically the option for this patient is going to be the treatment plan that this patient accepted was, after taking consent photo models, charting, etc., and doing standard of periodontal treatment and restorative treatment for this patient, and appropriate step planning in order to manage the space for this patient, we did implant surgery and provide this patient with also a all ceramic crown on the contralateral central incisor in order to sort of eat up some of that space and balance the two out. In terms of crown preparation impressions, it would be number 5, and then lastly, prosthetic delivery and a bite plane and follow-up for this patient. So in this photograph here, you can see that the patient is retracted. You can see that there is a bit of a buccal lingual deficit. Once we place the implant, you'll notice that there's an area which we need to graft, that's subsequently grafted with some IPRF. If you don't know what IPRF is, please watch the video on PRF techniques. Sutured into place, and this is the radiograph of this patient immediately post-op. The patient's given some time to heal. We used a tissue punch in order to access the implant. In retrospect, I wish I had just sort of done a little bit of a degranulate the tissue and tucked that connective tissue more towards the buccal to give him a little bit more buccal bulging of the tissue there. Did a crown prep on the adjacent central incisor, took an impression of them both, and here you go. You can see a picture of the impression impression of both the crown and the impression of the implant picked up at the same time, sent that off to the lab, and the lab basically sends us back a crown. So here's a picture on the left of the temporary crown in place and also of the healing abutment on top. And in the foot radiograph on the right, you can see that the crown has been cemented and that the implant and the bone graft and everything, it looks really nice. So that's that tapered screw vent implant along with the internal hex, 45-degree internal hex UCLA abutment, giving this patient a screw-retained position. That orifice for that crown is then sealed off with a bit of Teflon and some composite resin. And as you can see on the left versus the right, the before versus after, that this was a very successful aesthetic outcome for this patient. So summary, in terms of we talked about product introduction. We gave you specifications in terms of both the product, the packaging, and the reported features. We talked about what's new and what's missing. We talked about surgical and prosthetic tools and ergonomics. We talked about performance in terms of both price and quality. We talked about some comparables for this implant system, some case examples, and finally, the summary and conclusions. So what are the conclusions for this? So basically, the product is an excellent product. It's fairly easy to use. It's a very value-based implant. It's got excellent customer support. There is an excellent online ordering system, and if it was the case that you were to have any concerns and stuff, there's a network of reps throughout North America. I'm not sure about internationally, but throughout North America who can help you out with this. So with that being said, here's a few references that were used in the production of this product review. And on behalf of the entire dental treatment team at the Cataraqui Woods Dental Implant Institute, I want to thank you for listening to our presentation.